Good morning, everyone. Kia ora koutou tatu. So my name is Nathan Lachowsky. As I said, I'm studying at the University of Guelph, but I'm quite fortunate to spend from June previously up till April next year doing research with the University of Otago in New Zealand. And so I'm here to talk to you a little bit of some of the preliminary work that we started there with what we call younger gay men. And we started originally with the title Young, and then realized that these people didn't identify necessarily themselves as young, and we were putting that label on them. And really, what is young? Because age is an attitude, or age is a number, and old is an attitude. So we're going to be talking about younger and older gay men in the context of HIV-related knowledge, attitudes, and behavior. So we are currently at A, and that's where Auckland is in New Zealand. So Auckland is about 1.4 million people. It's one of the largest urban sprawls in the world, quite interestingly. And it's got some similarities to Vancouver, both in sort of its coastal attitudes, but then I think also from a point of view of sort of New Zealand and Canadian colonial histories and ethnic mixes and whatnot. But there's definitely some differences, and so what we're hoping is that through the presentation today, looking in the context of New Zealand and the younger gay men there, it'll give some reflections of things that are going on here, and hopefully be just a little bit of interest and some international knowledge as well. So I'm going to start with the background on New Zealand's HIV epidemic as a countrywide, and hopefully give that as sort of a framing of reference for some of the later on results, and then talk a bit about younger gay men in HIV. And then I'll do sort of a quick run through the objectives and methods, and then the results, conclusions, future research, and next steps. So New Zealand's HIV epidemic, gay men continue to be disproportionately and predominantly affected in that country by HIV. They comprise 71.4% of HIV diagnosis, so it's very much a gay men's disease still in New Zealand. And it's in other populations as well, but for sure the focus, both from the Ministry of Health's point of view and from the AIDS Foundation, is very much on gay men. And last year was the second highest number of new diagnoses among gay men in the country's history. And when they include unknown route of transmission, they expect that it would actually be the highest number of new diagnoses last year. So the numbers aren't in for this year, obviously, but it'll be interesting to see how things are going. And some of the characteristics, I think, it's N equals 90. So we're talking about 90 new diagnoses in 2010. And it's a very different number, but overall their country is about 4 million people. So when we look at the ethnic breakdown, those are percentages there on the right-hand side. So New Zealand European, or Pakeha, are about 70%. And these, interestingly, with the exception of Pacific, closely mirror the actual ethnic distribution in the country. When we look at place of infection, which I think is a really interesting characteristic that they collect, 71% of the guys said that they were infected in New Zealand. And so there's a lot of transmission it's not just happening overseas. Late diagnoses, 48%. And aged 15 to 29, it's 32%. So a third of the guys with new diagnoses are 15 to 29. So, younger gay men and HIV. There's definitely a unique New Zealand context and experience for the younger gay men. Homosexual law reform was passed in that country in 1986, making it legal to fuck your boyfriend or your partner or your husband. In 1993, they passed the Human Rights Act, which put the ground of sexual orientation as a form or something to be protected. And so there was a lot of rethinking at that point about all of the other laws that discriminate based off of sexual orientation. And so civil unions was passed in 2005. And so while marriage is not legal in New Zealand, all of the rights that go along with that can be had through a civil union. Doesn't necessarily mean that they're happy they can't get married. So availability and effectiveness of HIV treatments, that came into New Zealand in 1997. And that sort of improved the prognosis for HIV positive individuals. And one of the other things I think when we talk about younger gay men is this idea of connectedness to the gay community. And what is the gay community? And are they less connected, or is it a different type of connection? And in New Zealand, given the large amount of gay guys that are in the rural areas as well, how does online connectedness work? And what are online communities? And so I think that's something to think about throughout this presentation. And I think there's definitely, growing international interest in young gay men. And I think there's a beautiful presentation before me, and I love that piece of writing. And I think it is, we are always having a new generation. And I think the other thing is that the U.S. has recently documented an increase among their YMSM, and one of the few groups that have increasing rates of HIV infection. So the basic objectives of this presentation are to compare the HIV-related knowledge, attitudes, and behaviors between younger gay guys, which chose the label of 16 to 29 years of age, and older gay men, so 30 plus. And I think the idea here is that we're really talking about a strategy around primary prevention, and so stopping an HIV negative individual from getting infected. So the methods, we pooled 3 years of their socio-behavioral HIV surveillance, so similar to MTRAC, a type style of surveillance. And that gave us 3,387 young gay guys and just over 5,600 older. And we took the 2006, 2008, and 2011 rounds of that to do that. And it's sort of 2 streams, and one is the Gay Auckland Periodic Sex Survey, which is an in-person recruitment, and then the Gay Men's Online Sex Survey. It's basically thought of as another venue, and so it's distributed through their basically dating site, which is called NZ Dating. It's an anonymous and self-completed questionnaire, and it's a reproducible, convenient sample. So basically the methods are the exact same for every round, and we're now running it every 3 years. And it follows the World Health Organization's guidelines around second-generation surveillance. So the offline recruitment, so the Gay Auckland Periodic Sex Survey happens for 1 week in February. So that's their summer. So they have their festival called Big Gay Outs, which is sort of their pride event. And that's where we get about 30% of the pooled sample. Gay bars comprise 5% of the pooled sample, and then sex on-site venues, so bathhouses and sex clubs are 7.7% of the sample. Online recruitment then follows the offline recruitment. And so if you've done the in-person survey, then you don't do it again with the online. And that goes for 2 to 4 weeks. And that is basically the internet dating site, as I said. And I think the one thing to keep in mind here is that we can collect a lot of responses through the internet, and so that's why they comprise a huge part of the sample here. And then basically what we did with the statistical analysis is control for year, so any of the differences that might have been seen across the years. And in the pooled sample, we're controlling for that using a mental Hansel chi-square, and then multinomial logistic regression. So wherever there's an asterisk is where there's a statistical difference. It doesn't necessarily mean that's a very important difference or a very large difference, but this is something I want you guys to keep in mind as well. So this table here, you can see in the left-hand column young gay men, or YGM, and then older gay men, OGM. And basically what we saw is the younger guys were much more likely to be recruited online. They're also much more likely to be ethnically diverse. And I think that's an interesting thing. That's a bit of a changing trend in the country as well. And they were more likely to identify as bisexual. And we've talked lots about YMSM and that as a category, and there's some really great discussion at this morning's session in this room about that. And they have a tendency to use YMSM there, and part of that is because of this large percent of bisexually identified individuals in their community, but also because of cultural identities such as Takatapui or Fa'afafine. And so I'm using young gay men for this presentation in this community, but I think it's important to note that during a quarter of the sample isn't identifying as gay. When we look at testing histories, so when we look at tested for HIV, and we're excluding the known positives here, basically no difference in HIV testing, but there is a difference in the HIV positive result. And same thing with sexual health testing is there's no difference in the testing between the younger and older, and no difference in any other STIs that are reported. So this figure is looking at HIV-related knowledge, and basically all the yellow bars or gold bars are the younger gay men, and the blue bars are the older. And basically what we're showing here is the percentage that reported that they knew the 4 statements that are listed across the bottom were fact. And so these were proffered to the participants saying, these statements are factual. Please let us know whether you knew that or you didn't know that. And so I think the good thing is nearly all of the guys knew that anal sex without a condom is very high risk, but slightly less younger guys than older guys knew that. Younger guys knew that less younger guys knew that oral sex was low risk. Same thing with HIV being more easily transmitted in early stages or acute infection, and less guys knowing that HIV cannot pass through an undamaged condom. When we switch to attitude, so same color scheme and setup, what we're showing here is the percentage who agreed with the statements along the bottom, and I think the interesting thing is there's not a huge difference in attitudes that we saw. The 2 that are on the right are the 2 significant differences. The first difference being I don't like condoms because they reduce sensitivity. So less younger guys feeling that they dislike condoms, which I think is a good sign. And I think they were more likely to agree that a man who knew he has HIV would tell them before having sex with them. And I think that's an interesting result, I think, thinking about the reflection around discourse with partners and talking with partners about status and all things sexual. So definitely something for further qualitative exploration. When we look at sexual behaviors and condom use comparisons, I've just sort of picked out a few variables here to highlight. We're talking about in the past 6 months for all of these variables. And so I think younger guys were more likely to have no sex partners. And so that's in the past 6 months. But they're and also less likely to have greater than 5. So I think differing patterns in that regard. With regards to casual sex, they were less likely to have had any casual partner, but more likely to have anal sex with that casual partner. And then we see that same thing with the current regular partner. So less likely to have a current regular partner, but more likely to have anal sex with them. And the length of the relationship with that current regular partner was much more likely to be less than half a year, or much more likely to be less than half a year compared to their older counterparts. And I think I'm going to show you this line here that says one regular partner and casual partners on a figure in the next graph. But basically no difference in that sort of conjugation of sexual partnering. When we look at condom use, we broke it down by boyfriend, fuck buddy, and casual partner. And younger guys were more likely to use condoms with their boyfriends, no difference with their fuck buddies, and slightly less with casual partners. So this figure is looking at the sexual or relational partnering in the last 6 months of younger versus older gay men in New Zealand. And so basically what you'll see is the 6 sort of possibilities with the data set that we're working with. And so that first category is no sex with a man, and so that's the difference that we talked about. The next category is having one regular partner only. The category that follows that is greater than one regular partner, but no casual partners. The next category is one regular partner and casual partners, and then greater than one regular partner and casual partners, and then casual sex only. And I think the thing that's sort of interesting here is we didn't really find any differences. And I think a lot of times young guys say, oh, like we don't have sex like the older generation and during so on and so forth. But clearly during the experiences are varied within this large population. And there's all sorts of different setups and combinations that people are having. So in conclusion, there's definitely some similarities and definitely some differences. The younger gay men had less knowledge, fewer partners, less casual sex, but more anal sex, and had better condom use with their boyfriends, but less with their casual partners. And I think it talks to the fact that we do need strategic and targeted sexual health promotion for younger gay men. And I think part of this is we're trying to build research in that country, which has a huge paucity of gay research, to try and build evidence base for their health promotion and prevention efforts. I think some of the strengths is that it is novel research, so that no one in the country has ever taken a quantitative focus on younger gay men in that country. I think the data set that we're working on is a gold standard with regards to socio-behavioral surveillance. And I think it's great that we have the ability to collect it both online and in person because it gives us some interesting ability to do comparisons between those types of venues. And because we have a large pooled sample, some of the future research will let us do sub-analyses that we couldn't necessarily do if we had a smaller sample. Limitations, I think we can have a debate and talk, and that might be one of the things after this panel about during what is younger and what does younger mean. And should we be using age or should we be using time since coming out or identifying, however they choose to identify. And as researchers, that's a label and a classification that we put onto people, and is there a better way of doing that, which I'm sure there is. I think also impact of online venue. It's 58% of the pooled sample, and so I think it's important to keep that in mind. But it's not online sexual activity, okay? And so that's basically just that we're recruiting guys online. But any of the guys, whether in person or online, could have been meeting or having sex with partners that they met online. And that these are univariate analyses presented. And if we wanted to take into account confounders, we would have to do multivariate, which is some of the next steps. But I think what we wanted to do here was describe the community and describe that age group. So we didn't want to control for any differences that existed between the two different age groups. Because, yeah. And so next steps, we want to continue to disseminate. We've had some really positive reactions from community groups. So they're Rainbow Youth. Sort of sounds like Youth Co here. As well as the New Zealand AIDS Foundation. And we're trying to get it into the community through blogs and stories and getting people to engage with the results. And that's been really interesting so far. And it's nice that I think people are engaging with it. And then also we want to publish the results and start building more evidence and more rationale for greater funding dollars in that country. I want to continue with my research plan, which is doing multivariate analyses looking at condom use and HIV testing. And then following my research on youth, I'm going to be looking at some cross-ethnic analyses and looking at the different ethnic minorities of Asian Pacific Island and Māori. And I think generally it's always about advocacy and pressure for greater funding to continue and to expand the research that we're doing. And so I think when we talk about expanded research, there's definitely different geographic areas, and I think understanding the lived experiences of people in the different areas is important. And there's other populations at risk, so it's not just gay men. And I think the other thing is we need to look more into the differences that exist between within the younger community. And I think one of those things is looking at sexual activity with partners met online versus offline. And that's something that's been really new for that community there. And I think this data set cannot answer those kinds of questions that people might have. And I think the other thing is I'm a big fan of qualitative research. And I think it's important that, especially that commentary on sexual partnering and relational partnering, I think that's something that we need to talk to the guys about and sort of understand how that's working. And are those partners simultaneously all being managed at once, or are they sequential? And how are they're dealing with that, and how are they feeling about that? And I think as well, this is a very sort of, I think, classic EPI presentation around risks. And I think we need to start thinking about and talking about resiliency and protective factors, and that's something that EPI can do. It's not a limitation of the method or of the discipline. But I think that's something that we need to start pushing for. And in that country, I think they're a bit further behind in the discussions than what people are having here. So just want to acknowledge my collaborators at the University of Otago, who know some of the people over here, and so they were excited that I was coming over. So Pete Saxon and Nigel Dixon, the New Zealand AIDS Foundation, who's a partner on the surveillance system, and my advisors at the University of Guelph, Kate Dewey and Alistair Summerly, and then all the people who are involved in the funding. I think we're leaving those till the end, but thank you.